Welcome to Bad to the Bones podcast. On today's episode, we'll dive deep into the world of orthopedic sports medicine. I'm your host, Deborah. Joining us today is Dr. Fred McAlpin. He's a board-certified orthopedic surgeon, fellowship-trained sports medicine with Premier Orthopedic Associates. Dr. McAlpin is a fellow of the American Osteopathic Academy of Orthopedics, and he also serves as the director of orthopedic residency program at Inspira Health, where he teaches new physicians techniques for treatment of a wide range of orthopedic conditions. Dr. McAlpin specializes in arthroscopic surgery of the shoulders and knees, as well as sports medicine care. Welcome to the show, Dr. McAlpin.
Thank you very much. I'm happy to be here.
Yeah, we're looking forward to getting a better understanding of sports medicine. There's a lot of athletes out there, weekend warriors, and but first, let's start with, how did you start to think of the idea that you wanted to be an orthopedic surgeon?
I believe my parents had the biggest influence on that.
Really?
Both me and my sister, when we were young, our parents pushed education.
Okay.
And we always heard, you guys be either doctors or lawyers. Doctors or lawyers.
Really?
I became a doctor. My sister became a lawyer. So
that parenting worked out well. Are either of your parents a doctor or a lawyer?
My father had his doctorate in child psychology,
Okay.
and my mother had her master's in special education.
Okay.
So they were very much into education and bettering yourself, and I kind of developed that myself and wanted to educate myself as well as others.
So was there a particular instance in your studies that led you into orthopedic medicine?
That was an easy transition for me since I enjoyed sports so much. I played sports when I was very young and continued right up into high school and college. And so getting injuries when I was young and seeing other people with injuries, it was a natural transition to go, I want to be a doctor. I also want to take care of athletes that may have had injuries.
That's great.
It's something that I've always desired to do and enjoy doing now.
Yeah, it sounds like it brings a different level of passion to your work every day.
It does.
And so, you mentioned that you enjoyed the educating part of it, just educating yourself. And, you now are an educator and you train, orthopedic surgeons up and coming. What is rewarding about that process?
I see in their eyes the excitement of learning something new. And I feel the same when I'm at a meeting and I'm learning something and I see something that really brings something brand new that I'm going to be able to offer to my patients.
Yeah.
And so when I'm teaching these new orthopedic residents a new technique or a technique that I've been doing and they go, wow, that's so cool.
Yeah.
I see that excitement and I feel that same excitement. And I love being able to do that. And I don't stop just with my residents. I also do it with students when they come in and teach them something new in the office, and then just expand it right to my patients. So every day when I'm seeing a patient, I will not just tell them what their problem is, I'll educate them about their problem.
Yeah.
I'll bring out a model, tell them this is what your injury is, this is how we're going to make it better. And I think when they're educated about it, they're more inclined to be invested in getting themselves better and know why I'm having them do something. So I think it's been very rewarding, and it's been my natural way of teaching my patients and treating my patients and my staff as well as my residents. So
Well, that sounds like it's a really important bedside manner that you bring to Premier, which leads me to my next question. I mean, when you had a goal when you joined Premier Orthopedic Associates, I'm sure you had a goal in mind of what type of physician you wanted to be, to present yourself as to your patients and to the practice. Can you describe a little bit about that?
Well, coming out of practice, coming out of training, of course, I was thinking I'm going to be a pure sports doctor. I want to see football players and I'm going to see baseball players. And that came true too, but what I found out was everybody can be an athlete injury. It can be the worker that fell down and tore their rotator cuff, or it could be the grandma who slipped in the snow and injured her ACL and her meniscus. All of them want to be treated like an athlete and get the best care. And so I see everything from the high school athlete to the junior high athlete to the older patient who may have injured themselves throwing the football to their grandchild, and they want to get back to doing those things.
Yeah.
And that's all of our goals, is to get back to the things that we enjoy in life and be a part of that, and to be able to help patients get out of pain and get back to that function. Couldn't be more rewarding. So I love it.
The reviews speak for themselves as well, so we're happy to have you part of the practice in sharing that passion. As a leader in your field, there's the subspecialty of arthroscopic sports medicine. What's involved in that?
Arthroscopic had been developed in order to treat treatments of the joints when previously we had to make fairly large incisions to get to the joint. So think of making a large incision can be anywhere from 4, 6, 8 inches over a joint, whether it be a knee or a shoulder.
Yeah.
We would then have to move the muscles that overlie the joint to the side to get down to the joint to repair what injuries were present. I'm a perfect specimen of that. I was playing football when I dislocated my shoulder. And back in those days, they would make incisions over your shoulder in order to get down to repair the damage. That same treatment that we did back in the 90s, I now do with just little poke holes. So we can make about an inch poke hole and use instruments about as big as a pencil, pass that down to the shoulder joint or the knee joint, and be able to put stitches or different types of anchors to repair the structures. Now we aren't doing damage to those overlying muscles. Those muscles lay intact. And so it can lessen the pain and sometimes improve the speed of recovery because you don't have to have as much damage to the collateral structures in order to have the fast recovery and the less painful recovery that we would like to have for patients to get back to their activities.
I mean, to me, that seems like such a major advancement in medicine, in surgery. Are there any other innovations that have been game changers for you that you feel is unique to orthopedic sports medicine?
Well, in my practice, I do everything from the weekend warrior to the patient that had been doing weekend warrior things and gone on to arthritic changes as a result.
Yeah.
And so one of the biggest game changers, I think, has been in our knee replacements. I think in the past when I was treating knee replacement patients, you would see the patient get out of bed with a walker. They'd take 3 or 4 steps. Then they would have to sit back down. They would go to rehabilitation for maybe a week, if not 2 weeks, and then come back into my office in about a month and a half, 2 months, maybe still using a cane or a walker.
Yeah.
We've made such advances that now we're doing those knee replacements same day. So the patients come in the morning, in the recovery room, they're lifting their leg, they're walking around the rehab or around the recovery room comfortably.
Yeah.
And waking up with 1 to 0 pain. They come into my office not using walkers, not using canes. I saw a patient today who was 6 weeks out, and she's doing so well, I released her. Typically, I'm not releasing patients till they're 3 months out, 4 months out. So they're just doing extraordinarily well and fast. And I think it's more of a sports medicine type philosophy where we're doing these things through smaller incisions and doing less collateral damage. And it's a team approach, though. So we have the anesthesiologists that are doing amazing blocks that are lessening patients' pain. We're educating patients about how to do their exercises, physical therapy helping out to try to get patients back to normal. So it's a great advancement, I think, in the most is what I've seen with knee replacements.
I think also for anyone who's vain, it's nice to have a smaller incision
Indeed.
than have this large incision mark. Is there any truth? I hear some of my friends have had knee replacements as from sports injuries over the years and such, and it seems to be one of the most painful recoveries. Because your whole body's it's bearing the weight of your whole body. Is there truth to that, or is it just really a more complex healing?
I think there was some truth to the fact that you had a great deal of pain afterwards. And what our techniques have been in the past was we would provide them with very strong pain medications, maybe through their IV.
Yeah.
So they would control pushing their IV, and then they'd be drowsy, so now they're too tired to walk.
Yeah.
And so the advancements came with nerve blocks.
Okay.
The nerve blocks around the nerves that feed the knee, the anesthesiologists were performing. And then right before we put the knee in place, we would then inject the knee with medicines like you might get with the dentist. And that has reduced the pain with these longer acting pain medications for sometimes 2 or 3 days.
Yeah.
So you don't have that big wind up pain. Pain does come, and we give pain medications to help with that. The smaller incisions make the pain a little less. And so the patients do have pain, but it's much more tolerable. So in the past where I would have a patient sometimes come in and say, I'm glad I got my left done, but I'm not coming back for my right.
Right?
Now in their rehab, they're going, in 4 weeks, let's schedule my next knee. I'm ready to do my next knee. And so while the pain is present, I don't think it's quite the same magnitude.
And what kind of conditions are you seeing that result in surgery?
Well, all different types of conditions I like to try to treat sometimes without surgery, and then some conditions will require surgery. And so it's evaluating those different conditions and seeing what that particular individual requires and what their goals are. So my football player who may have been injured in high school with an ACL tear, that person wants to get back to playing football. And that person, there is no real non-operative management for an ACL tear when you want to get back to cutting and pivoting sports.
Yeah.
So I'll communicate with them what their goals are, and we'll talk about how we can get their ACL reconstructed to get them back on the field. My 60-year-old who might have slipped getting out of the bathtub and tore their ACL says, I am not going on any football field or soccer field.
Right.
So then we might talk to them about how we can rehab their knee with strengthening and exercises, and possibly just using a brace so that when they go out and mow the lawn, they'll have the support that they need. So my philosophy is I tailor your treatment to you, not to your injury. And so those two individuals both may have an ACL tear. One needs one treatment, one needs the other. One needs surgery, one doesn't need surgery. So not uncommonly, my patients will come in and I'm the one talking them out of surgery rather than into surgery, telling them, you don't need surgery for this. Let's get you better and see if down the road you need surgery, we'll do it. If you don't,
that's great to know. And I think they're really great examples too, because it really demonstrates that you are customizing. You know, you're getting to know what is the lifestyle you want to get back to so that I can develop the proper treatment plan for you. And like you said, oftentimes it doesn't have to be surgery. You know, if it's just your average Joe, so to speak, just getting out of the bathtub and not looking to get back on the field, there's physical therapy can really play a role in that. How about with female and male athletes? Do you see drastic differences in the injuries and what presents?
Absolutely, and I think female athletes have been getting much more involved in sports these days. And so we have female athletes in the past that might have been playing purely field hockey. Now they're playing football, they're wrestling, they're playing soccer year round. And so we're certainly seeing many of the injuries that our male athletes were getting. And some injuries that females are getting much more than the male athlete. When I came out of my training, I was expecting to see all these football players with ACL injuries. And it turns out I was seeing all these female soccer players with ACL injuries.
Really? That's interesting.
And so it turns out that females can be almost 4-to-1 getting ACL injuries, especially with AstroTurf and things like that. And there's some philosophies on why females may be a little bit more prone to those type of injuries. And I'll try to educate my patients about that and especially look for those injuries if they come in and see how we can make them better. And sometimes to a degree prevent them. Sometimes we can't prevent them, but at least we can get them back on the field so they can play and do the things that they enjoy. So ACLs are one example of where females have a way higher chance of those type of injuries than our male patients do. And I'll actually go over why that happened, how we can strengthen them, maybe we can prevent them from having another one or getting it on their other knee.
And so with athletes, if they have an injury, it's pretty clear that they're going to want to go seek medical attention. But if I'm just having kind of an ache and a pain, you know, in a particular joint that you specialize in, how do I know when I should seek medical attention and see someone like you, a sports medicine physician?
Well, we're all a little different, you know, and we say that the males are going to be real quick to go see somebody and the females are going to wait because they're so busy and they don't have time. So it varies from person to person. And I think one of the general things you want to do is if you're having a pain or an injury that is not gone away in several weeks and it's starting to significantly affect your activities of life, you're limping, there's a lot of swelling, you're finding that the typical time frame when your normal sprains that you had in the past have typically gone away and this one is not, get it looked at. It's just so easy to get educated about your injury, find out how we can get it better so you can get back to what you want to do. And especially don't be fearful that you're going to see a surgeon and they're going to tell you need surgery. Many times you're not going to need surgery unless you get the education on what may be necessary so that you're not going to go around with an injury for another 2 months that could have been better if we just seen you in a month or two before that. So I think there's nothing wrong with education and nothing wrong with an evaluation, and then you can make your decision on what you would want to do.
Well, and in that same thought process, I know you're an advocate for, you know, preaching injury prevention, educating on that. What would be some of your best advice to athletes for prevention of injury?
I think one of the best things that we would recommend is moderation, actually. a lot of kids are playing the same sport year round, and those are putting them prone to injuries and changing up some of those different sports. I'm not saying you be a couch potato during the summer,
Right.
but our soccer player maybe then going on to a different sport that will lessen the repetitive stresses to that joint may help expand and prolong their athletic career.
Yeah.
Speaking with some of the professional sports recruiters and professional baseball players who look at those injuries, they don't typically like a baseball player who says, I've been a pitcher since I was 4 years old. They would rather see somebody who, did some pitching, and I played third base, and I played soccer. They want that well-rounded athlete who is not going to have so much stress to their shoulder that they only have another 1 or 2 seasons left in that shoulder.
Good point, yeah.
And so playing summer ball, then playing winter ball, and being on 3 different teams, we see a significant amount of repetitive injuries to elbows and shoulders that can be avoided by moderation.
And that sounds like a conversation for the young ones that we might have to have with the parents.
Exactly.
Get out there, you have to play, you have to be doing something, you're not sitting around all summer.
Exactly.
So, well, what injuries, I know you talked about physical therapy and how that can actually be a treatment rather than surgery. What are some of the injuries that you see really respond well to physical therapy instead of having to rush into surgery?
And that's been a question that a lot of my patients have been a little bit nervous about. They'll come in and see me, and let's say they have a rotator cuff tear, and they'll say, physical therapy is not going to do anything for me.
Yeah.
And I tell them, not so much. No, it's not going to make your tendon go back to the bone.
Yeah.
But rotator cuffs are not just one tendon. They are actually a group of 4 tendons that surround the shoulder and help you rotate and lift your arm. All of those tendons or muscles are in shock when you injure one of them. And bringing the other muscles back to their normal or as high a strength as possible can sometimes allow you to compensate so well that you may not need surgery.
Yeah.
And if it doesn't get you to the point that you don't need surgery, I would rather that patient going back to a surgical procedure with 90% of their motion and strength than coming out of a surgery with only 30% of their motion and strength.
Very good point.
And so doing some of that strengthening in physical therapy for whether it be an ACL injury, a knee injury, or a shoulder injury can prep that shoulder for the surgery that may be necessary in the future, or avoid the surgery that might have been necessary because they did so well and they're not having pain or functional issues. And then, of course, after surgery, the physical therapy can be very important to do, so you're maintaining the motion and strength that will be necessary to return to your sport. So I think it's a nice adjunct to help a patient be able to get back to where they need to, even though it doesn't magically repair a tendon or magically repair the structure that you might have damaged.
Yeah. Well, it seems very clear that orthopedic sports medicine plays a vital role in keeping athletes healthy, performing at their peak. And Dr. McAlpin, we thank you so much for joining us today and sharing your knowledge and your expertise with our listeners. If you or someone you know is an avid athlete, a weekend warrior, or just, an active senior who is experiencing pain, get them in to see Dr. McAlpin. It's worth the visit just to find out if it could be something serious or maybe it just is a conditioning treatment that's needed, physical therapy, something light. Anyway, we have offices across southern New Jersey in Cumberland, Salem, Gloucester, and Camden County, and you could text us or call us at 856-690-1616. Our newest location is in Deptford, across from the Deptford Mall. We are part of the Inspira Health Center building, so we're excited about that, really serving and providing more care for our Deptford community. But that's all the time we have for today, so we hope you join us on our next episode of Bad to the Bones. Until then, stay active and stay healthy.